Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, how are you? I hope you are always well healthy and in the protection of Allah. Amin. Introduction, my name is Zahrotul Auliyah with name 2004011109290. English Class 2 Psikologi G. State Islamic University Maulana Malik Ibrahim Malang. Before starting, it would be nice if we press to so that the knowledge we learn is visible. Get please and the presentation goes smoothly. Bibarakati wa karamati Syekh Abdul Qadir Jailani wa bisyafa'ati Nabi Muhammad sallallahu alaihi wasallam. Al-Fatihah. Definition of phobia. Phobia is a concept, excessive, unrealistic fear of an object, animal, activity, or situation. This condition is one type of anxiety disorder. Fear phobia is a condition of limitation due to the influx of anxiety and fear of something. Phobias can be said to engage people who suffer from its phobia can limit the existence of person, speak thoughts, anxiety, and fear. Types of phobias. There are more than 100 types of phobias, but in general they are divided into three groups. Namely, number one, agoraphobia is the unavoidable fear of place or situation. Number two, social phobia is social anxiety disorder. And three, specific phobia. Next, various kinds of specific phobia. The first, glossophobia, is performance anxiety or fear of speaking in front of people. The second, acrophobia, the fear of being left behind. The third, claustrophobia, fear of confinement or narrow space. The fourth, aphiphobia, the fear of flying. The fifth, dentophobia, fear of dentists. The sixth, depophobia, phobia of blood or injury. The seventh, acronophobia, phobia of spiders. The eighth, chaetonophobia, phobia of dogs. The ninth, opidiophobia, phobia of snakes. The last 10, mythophobia, fear of dark cetacean. Next, phobia signs and symptoms. A person is a greater risk of developing a phobia if there is a prior history of anxiety disorders. Other risk factors are socioeconomic status, and gender. The most common symptom of a phobia is a panic attack, which then develops into the following symptoms: pounding or pounding heart, shortness of breath, difficulty speaking, their mouth, stomach pain, nausea, his blood pressure, trembling, cat pain, shortness of breath, seizures, cooking sensation. Next, cause of phobia. Phobia can be experienced by anyone, someone since childhood, adolescence, until they are more than 20 years old. There are various reasons a person experience a phobia. Based on the type of phobia they experience, that is, number one, specific or simple phobia, reported from the National Health Reservoir UK. This type of specific phobia or simple phobia is one type of phobia in which a person has a phobia of something very specific. For example, a phobia of an object, animal, situation, or activity. This phobia is commonly experienced by children up to their teens. Number two, complex phobia. Reporting from medical news today, general complex phobias develop in adulthood generally This phobia appears when a person is faced with a certain situation. There are several factors that cause a person to experience this type of complex phobia, such as a combination of life experience, brain development, and genetics problem. The process of framing a phobia, when the response of fear or aggression is intention, the amygdala will release hormones into body to part the human body into a substance. Next, phobia risk factor. There are various risk factors that can cause a phobia in a person. For example, family history. Many experts believe that phobias are caused by genetic factors, psychological injury, or traumatic event. Characteristic of self. A person might develop a phobia if to say pessimistic and the nose are sensitive. X. Phobia are more often experienced by those who are still young. For example, children or adolescents aged 13 years. Hearing something or information that is fascinating, for example, such as a plane crash. Next, phobia diagnosis. To diagnose a phobia, the doctor will conduct a medical interview about the symptom, followed by the sufferer. The symptom will be observed by the doctor. Whether or not it leads to a phobic condition. In addition to confirm the diagnosis, the doctor will also ask about the history of the deaths that the survivor has experienced, including mental illness, the pain's social life to the history or disease. Next, phobia complication. Phobias that are not treated effectively can cause several complications in the sufferer, starting from confining unsafe social isolation, changes the atmosphere, drastic liver or anxiety disorder, alcohol or drugs abuse to sketch. Next, phobia prevention. Actually, there is no effective way to prevent phobia. However, if you have a specific phobia, for example, consider asking for help. Psychology, especially if the sufferer already has children, the recent genetic factor tend to play a role in the development of specific phobias. The such of kids who repeatedly see their parents' phobic reaction might be afflicted or develop a specific phobia in them. Next, phobia treatment. The overcome phobias, doctors will usually use drugs and psychotherapy. Psychotherapy can be in the form of express therapy to catch the perspective and a scary subject or situation, and cognitive behavior therapy (CBT), which combines expressive therapy with other therapies. CBT is more focused on controlling thoughts or feelings. Besides that, treatment of phobias can also be through the administration of drugs that are expected to reduce the symptoms. Next, one to doctor. Phobias such no be text and likely because they can affect daily life and activities. If the phobia is getting worse, it occurs frequently and gives panic attacks or symptoms. Basically disturbing such as cold sweats, nose dizziness, first heart palpitation, shortness of breath, the loss of consciousness. Takes to the doctor immediately, gets medical treatment or therapy. In conclusion, phobia is a symptom of anxiety which has a hundred skin, but generally there are only three for those of you who have a phobia, face it and keep going, because I'm sure that even if you have a phobia, you have something that is very beneficial for yourself and others. Keep smile, keep strong. Words of wisdom: fear is the main source of self-protection and one of the main source of certainty. Overcoming fear is the beginning of wisdom's better result. That's all for me, more or less sorry, and I will continue to learn. Thank you, our spirit. See you again. Wallahul muwaffiq ila aqwamit thoriq. Wassalamualaikum warahmatullahi wabarakatuh.